If you think replacing the heart valve with an artificial valve is one-stop solution, you may not be completely correct. When we replace that valve with a mechanical valve or the metallic valve, the patient has to be on a blood thinning tablet. These tablets are called acitrum or warfarin. The patient has to visit the doctor to make sure that the dose of warfarin or acitrum he is taking is adequate, and the blood test called PT and INR has to be repeated every month. When the patient undergoes even a minor procedure like a dental extraction, removal of a tooth, or a major procedure like an appendectomy or a fracture, the tablet has to be stopped. It has to be bridged with a drug called heparin. The procedure has to be completed, and we have to restart these tablets. It's a complicated procedure which cannot be done in all hospitals. When we replace the valve with a tissue valve, these valves have a durability. At the end of 8 to 10 years, these valves start deteriorating and start leaking once again. So these valves have to be either replaced or another procedure has to be done at the end of 10 years, especially the tissue valves. And both the mechanical valve and the tissue valve are prone for infection, and if you get infection of these valves, it's very difficult to manage. Valve repair rather than replacement is going to be the ideal solution. When a valve leaks, we call it regurgitation, especially when the mitral valve is leaking. Most of the valves can be repaired. There are 3 types of diseases which affect the mitral valve and cause it to be leak. These are either the rheumatic heart disease, or the ischemic heart disease, or the myxomatous heart disease. Luckily, in a state like Tamil Nadu, where the socio-economic status is improving, the incidence of rheumatic heart disease is drastically down. The second type of which is ischemic, where a heart valve leaks after a heart attack, can be repaired. Most of the valves we are dealing with right now in the mitral position are the myxomatous valves, and nearly 100% of these valves can be repaired.